hospital. They were told there was shortage of consumables. This meant they had to resort to private facilities to get their dialysis done, which they claimed puts undue financial pressure.
This morning, when we came back trying to find out from them what exactly was going on, and we were informed that they are now going for a meeting to ascertain the situation of them. But I think after some hours, most of my patients started calling, they've been called to come back. And I think the unit is working now. As to whether it's going to continue or not, we are yet to find out how it's going to be. We just thank God that for about 2 weeks now, we've not had any bad news. But most of my patients are complaining. Some of them are saying they are bleeding through their nose.
President of the renal disease patients, Kojo Bafwa Hinkra, maintains they are unhappy with the recurrence of the situation, demanding answers.
In fact, personally, I was not expecting to hear some of these things again. Because I think last year, we had a lot of challenges of this thing. And I was hoping the authorities will set up on this issue. Because the question is, do you sit down to say the consumables are finished, you don't even have for the outpatient? It's neither here nor there. I mean, we don't take this excuse. We don't know what is going on, whether it's politics, whether it's real. Somebody needs to come and talk to us and tell us exactly what is going on. These are human lives.
Authorities of the hospital are, however, yet to make an official statement on the situation. Sarah Apenkru, TV3 News, Accra.
Welcome to the MG National Forum. In the next 3 hours, we will be discussing the state of our health facilities. We'll explore critical issues and find interventions. Join our experts in the field. And now, let's meet our moderators, Roland and Kemeni. Welcome to the MG National Forum. In the next 3 hours, we will be discussing the state of our health facilities. We'll explore critical issues and find interventions. Join our experts in the field. And now, let's meet our moderators, Roland and Kemeni. Welcome to the MG National Forum. In the next 3 hours, we will be discussing the state of our health facilities. We'll explore critical issues and find interventions. Join our experts in the field. And now, let's meet our moderators, Roland and Kemeni.
And so good morning to all of you. I'm here with... Well, certainly. And we'll be here till 12. But it also means that you know why we have to talk about this very subject. It is the National Forum of Media General. It's not only live right here on TV3, but also 3FM 92.7. We are also streaming live. So the good thing about it is, once you're watching, it also means that you only have to share and contribute to the discussion. Now, this is what it is. Access to quality services constitutes an important component of inclusive development. However, have health facilities in Ghana become death traps? Are regulatory requirements being enforced to safeguard the integrity of health facilities? Because there are more questions, Kemeni.
Indeed, Roland, what is it that they say about health? It is wealth. And I want to ask you, how wealthy are you this morning? How wealthy is this country? Does it even matter that health facilities align with regulatory standards? Let's reflect on these critical questions as we throw a searchlight on the state of health facilities in Ghana. Now, for millions of Ghanaians who seek medical care, the state of health facilities remains a source of concern. This begs the following questions, and I'll take you through them quickly. Whose responsibility is it to set standards with respect to quality healthcare delivery in the country, as well as licensing of these health facilities? What ought to be done to ensure compliance of regulatory standards with a view to achieve improved health outcomes? So join us as we focus our lenses on the extent to which health facilities meet quality standards. You're welcome to our very first thought leadership event here at Media General. the National Forum on the State of our Health Facilities.
Now again, have Ghana's health facilities become death traps? And that's a key question we have to ask, because what interventions are required to ensure that health facilities also operate legally to achieve quality health services? Indeed, as you join us, we will be asking our duty bearers, and as one of the leading media organizations in Ghana, we, alongside you all, will be demanding accountability, responsiveness from our duty bearers. We also interact on our social media platforms, especially on X, Facebook, YouTube, as well as Instagram and all the others. It is the MG National Forum. You can also join us with the same hashtag, MG National Forum. Hashtag again, State of Health Facilities. And I tell you, we've been doing a lot of work. Godwin Asediba, it could be Ibrahim, Abubakar, or whoever across the country, just to make sure, Kemini, we get the content and look at the issues for duty bearers to also solve.
Oh, absolutely. And listen, we've had stories from across the country on the state of health facilities all over the country, from CHIPS compound to regional hospitals to referral hospitals. We've seen them all, and today we'll show you each and every one of them as we have a conversation on the back of that. You'll also meet our guests pretty shortly, but let's link to that video from Godwin.
My journey began with a daunting challenge, traveling from Nawuni to Singa and Tamale, involving a crossing over the White Volta. Without life jackets available, I had to navigate the river just like the locals. What if resounded in my mind throughout the canoe ride. Despite the smooth waters, it was a deeply unsettling experience for me. On the other side of the river, I observed people arriving, their feet caked in mud, clearly exhausted. They warned me about the challenging road network ahead, but my determination to reach Senga held firm, and so my journey continued from there aboard a tricycle. About 10 minutes into the journey, the rugged nature of the road caused my stomach to churn uncountably. It was a harrowing, frightening and perilous ride. It took us about 2 hours to reach Senga, a community in the Kumbungu district of the northern region. The community's poor roads severely hinder healthcare access, leaving residents deprived. The Senga Clinic, the only health center here, is inadequate for providing health care to the sick. Upon arrival, I found patients already admitted at the detention room. With a shortage of equipment at the health center, nurses were forced to improvise to provide care. The facility has been leaking whenever it rains for days.
It's supposed to be our dispenser. And because of we lack so many things here, that's why we converted it here to be our where we can put our fooders and then other things here. And you can see this fridge too. We're supposed to have a proper fridge where we can even have thermometer, determine the temperature of the fridge here. And then, as you can see, we have vaccines here. And then sometimes we have to remove some of this ice pack here, put it here, and then collect all the vaccines here, just to manage the temperature.
Is that the right way to preserve them?
It's not the right way, but we are just managing here.
Sustainable Development Goal 3 emphasizes good health and well-being, aiming to ensure healthy lives and promote well-being for all at every stage of life.
For all cancer patients, about 60% of them will require radiotherapy at a point in time of the management of their cancer. So radiotherapy is a very important aspect of the management.
According to the National Cancer Institute, radiotherapy is a cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. Ghana has about 2 of such machines, one at the Kolebu Teaching Hospital in Accra and the other at the Komfanochi Teaching Hospital in Kumasi. One private healthcare facility also has the machine, but the challenge is the machines at both Komfanochi and Kolebu frequently breaking down, leaving many cancer patients stranded.
I'm to pay 13,650 at Kolebu. But as it stands now, I can't even do it at Kolebu. I'm doing it at Sweden Ghana, possibly, if I get that funds. And Sweden Ghana is charging me 37,500 cedis, which is 3 times what I would have paid at Kolebu if the system was working.
Treating cancer is like killing a snake. Once you initiate the action, go and make sure you kill it. Now, if you don't kill it and it gets back to bite you, it bites with a lot of venom. You are receiving referrals from 12 of the 16 regions of the country. And this is the only radiotherapy center in the northern sector of the country. So it's like every 10 million people have access to one machine. When the International Atomic Energy Agency feels that about every million people should have access to one treatment machine.
Bodies once again are piled on the filthy bare floors covered in flies. The dilapidated conditions have only worsened, with water droplets from decomposing bodies pooling on the ground, unable to drain due to clogged and poorly maintained channels. The drains, now more choked with filth than ever, are breeding grounds for maggots and other vermin. Despite the public outcry and promises of reform after my first visit here, the situation has deteriorated even further, turning an already grim scenario into a ticking time bomb of public health. The storage rooms, already overcrowded during my last visit, are now beyond capacity. Bodies are decomposing at a rapid rate, creating a hazardous environment not only for the mortuary staff but also for the surrounding community.
Well, you look at that content by Godwin Asedeba, it also brings into focus and perspective the current state of facilities across the health sector, and that also means that we have to put more focus on the subject as well. And Kamani and I quickly will have to go through the marshaled guests we have this morning across all forms of organizations and spectrum when it comes to healthcare and management right here in Ghana. And so straight away I'll just have to start from my end, and I have here first seated, just also across me, I have to say my extreme left, is Perpetual Ofori Ampofo, and Mrs. Perpetual Ofori Ampofo is also the president of the Ghana Registered Nurses and Midwives Association. Indeed, before the start of this, emphasized that, well, we like making the mistake calling them midwifery instead of midwives. And good morning to you. How are you? You are a regular on TV3 as well as 3FM and across Media General because of Daniel Opoku, our lead Labour correspondent, who is always featuring you. Yeah. And then also Dr. Nawani goes by the first name Mark, has a middle name as well. What's your middle name?
Kate.
Kate.
Yes.
And well, it's good that we've brought you here because you're coming from the Committee on Health in Parliament.
Yes.
Yeah. And you're also a member of Parliament. Which constituency?
I represent the good people of Nabdam.
Nabdam.
Yes.
Okay, so it means that this one, particularly looking at the demography of the constituency, also falls into sharp focus.
Exactly.
Okay.
Exactly.
And then also making sure that he's able to help us right here is the acting registrar for HEFRA. And Dr. Winfred Ba is here. That's the Health Facilities Regulatory Authority. Dr. Ba is here. Dr. Ba, you're in blue as me.
Yes.
We love blue, right?
Yes, we do.
But these are very thorny, sensitive, but important issues we're talking today.
Sure.
Well, Kamini, can you do introduction of your guests as well? And then we'll come ask them one or two other questions in relation to the story that was put together by Godwin Assedepa.
Absolutely. On this end, I have to my immediate left Dr. Senano Kwesi Jokoto, who is the Deputy CEO of the National Health Insurance Authority. Next to him is Dr. Wallace Odiko Olenu, who is Acting Program Manager, Non-Communicable Diseases Control Program at the Ghana Health Service. And then behind him also is Echo Beckles. Echo Beckles is a representative from the Health Service Workers Union. You're all welcome. Perhaps I should start from here, then I hand over to Roland on the other end. I'll start with you, Dr. Jokoto. You saw that the insert we just played, that documentary on our mortuaries. But before we even look at that, talk to us about how critical it is to take a look at our state, or the state of our health facilities.
Thank you very much. And I think this is a very good opportunity for us to highlight some of the gaps within the health delivery system in Ghana. But before we get there, obviously it's always good to talk about the progress that we have made.
Well, Doc, I apologize. It would appear that your microphone is off at this time, but you'll fix that. Then we learn what your thoughts are about this event quickly.
So thank you very much once again. And let me applaud Media General for putting together this very important dialogue. It would help us to look at the gaps within the health sector, health delivery system. But before we get there, we also have to acknowledge that some progress has been made over the years. So firstly, our life expectancy has improved over the past 3 decades. We have also seen a decline in maternal and child health mortality. And we've also seen very good vaccines.
Indeed. Doc, I know you have a lot of important things to say. Unfortunately, the microphone won't let us hear you. So what we'll do is we'll hand over to Roland, and then he takes on the conversation. Roland, you come back to us, and then we have ours too.
Well, certainly. And first we'll then have to get to Dr. Ban here. And you're not new to health practice, health facilities, and the state of infrastructure. Indeed, all of you are not. But you take the cognizance fact of that content by Godwin Assedepa in relation to what the vex matters are. You have to say that we could do better. Why do we have the facilities in the state in which they are?
Well, thank you very much. And I think I also want to applaud TV3 and Media General for putting this together. This is an important conversation. And in the heart of excellence is data. I think that what we want to do today is very important. We need to look at the situation, the way it is, and then look at how we can put things together to make sure that our health delivery in Ghana is better. So I think there are challenges. Some are resource. We have financial challenges, we have human resource challenges, infrastructure challenges. I think, like he said, we've made some progress, but we are still not there. Somebody said that in the modern Ghana, our hospitals or health facilities should be like hotels, where people come, you sleep, you have peace of mind, and then you have quality service. You bear with me, if you go to a hotel, that is not good. The bed is not nice. You can't even sleep well. There are mosquitoes all there. You can't sleep well. You wake up and you are even more tired instead of going to rest. In the same way, when you get to the hospital, the environment must be nice. You must also get good quality service. And I think that is where we are getting to. For me, this discussion should be able to get us to that level where we can get our health facilities to be up to date and our health quality systems up to the level we all want it.
Then that transitions are, because we'll come back to the practitioners there, because they then tend to face the drudgeries of having poor infrastructure. You tend to go around very often, and in the course of our work, we go with you. You visit the facilities, but the concern is that we elect you into parliament. Some of you even become ministers. You even get to serve on the committee, and rightfully you're here because of the committee. And you know that the situation is bad. Because you're not only somebody who is on the committee, you're also a member of parliament. Sometimes some of you even become MPs, and then you become the health ministers. If you look at the facilities as they are, why is it that when we do the allocations in the annual budget, we don't ensure as committees that the rehabilitation of the facilities are done?
Let me say good morning to the viewers of TV3 and say that I've been practicing practically the whole period of this fourth constitution. I mean, this period.
In this fourth republic?
Yes.
You've been practicing as a professional?
Medical doctor, okay. Yes, since 1993. And I've seen the genesis or the changes that have gone on over the years. Indeed, funding of our healthcare system is what is at stake. We have an increasing population. We are becoming a lower middle income country. So there's lifestyle changes. And so we are also, and we're being able to diagnose certain disease better than before. And so the cost of healthcare continue to balloon since we can now take care of those diseases. And so we need more funding to be able to meet the cost of healthcare. And as a health committee, we have positioned ourselves in such a way that we are looking at ways and means that the healthcare system can get more money to manage the healthcare in the country. That is our main aim. If you see
you
last year,
aim? You mean you, those on the committee?
Yes, the health committee. We are thinking of our best to push the system to create more resources and use the resources to improve conditions in the hospital, use resources to motivate staff to stay at wherever they find themselves, because that is the main problem that we have now. How to motivate staff to stay wherever they want to stay, they have to stay, and how to improve the conditions in terms of maintenance of the infrastructure. And to be able to do that, we need more resources. Currently, we're doing 9%.
By way of the allocation?
No, Abuja declaration.
Yes. Says 15%.
15%.
And you guys
we're doing 8-9. Yes, we fall short of even the 15%.
Even though you meet the WHO standard of in excess of the 6.
We are near it, but the issue is that we fall short, and we don't have enough resources to take care of the patients. And so what do we do to get this gap? First and foremost, we need to fill the gap. And then we can now meet the standards that have been set. Let us just remember that the universal health coverage targets, that's 2030, is just at the corner. And so we need to do something special to ensure that we're able to meet those targets. And those targets, we have to try and meet them and be with the civilized world. Should I say so?
Well, we'll come back and then talk about this more, because we have a framework, right? And that framework also means that Ghana, we also have our own target set. We're making the effort. But the question coming in will be, are we too slow in setting those same goals and trying to achieve them? But we'll see how that goes, Kemini.
Indeed. First, Roland, let's pick initial thoughts from my guest here on the documentary we have shown already. And just a quick reintroduction of my guests. To my very far left is Dr. Wallace Odiko Olenu. He's with the Ghana Health Service, and he's the acting program manager, Non-Communicable Disease Control Program. To my immediate left is Bright Emisa Nyakon, who is with NGOs in Health. Gentlemen, again, thank you so much for joining us on this national forum on the state of our health facilities. Now, because the conversation has already started on the documentary. Let me pick your initial thoughts on what we have shown so far about the state of our mortuaries. I'll start with you, Dr. Oleno.
Yes, very good morning to you all, and I really I'm very impressed with your decision to have this conversation at this very critical point. It's very, very important that we have this discussion. I want us to realize that health infrastructure is a human rights issue, and it's a national development issue as well, because we cannot achieve universal health coverage, as the previous speaker said, and our SDG Goal 3 without providing equitable and then safe quality healthcare to our populace. So it's very important that we ensure that all policies that are geared towards ensuring that we provide all these services to our clients, our populace, is very, very important. And we should also remember that infrastructure doesn't necessarily mean only the physical buildings. We also have to remember that it involves the policies and the systems that run the institutions. So when all those systems are in place, then the infrastructure can be said to be complete. So I'm looking forward to very fruitful discussions, identification of the gaps, and then most importantly, how to chart the way forward. Future, we'll look at how we can improve the state of our health facilities. Thank you.
Indeed, and that's why we are having this forum to look for better ways to handle our health facilities. But Bright, I come to you now. One thing that is assured for all of us is death. Looking at the state of the mortuaries, how does it make you feel that perhaps this could be the end point for you or your relative or anybody you love so much?
Yeah, thank you very much, and a very good morning to the panelists and your audience, TV3 and 3FM and the others. I'm also grateful we are here to contribute our bit to this discussion of the National Health Forum. You would agree with me that if we look at the videos that you showed concerning the state of the morgues, you get devastated as a human being. This is your end result, and that is where you would be going to. If you happen to live in a very hospitable condition, and then you see some of these videos showing, then what comes to mind is you think of, is it possible to even design your own morgue in your house, which is largely impossible. So it means that we all need to think through and then look at how we end our life and then where it gives us peace moving forward. Everybody in one way or the other might go through this system before you are declared where you are supposed to go, whether heaven or where. And I think you believe in a peaceful environment gives you a very peaceful rest. And that is what we should be thinking of, to at least begin to warm our souls and then drive home safely to meet our Creator, the Almighty. So it is actually not in the best of situation or state, and then we need to do something about it. I believe this forum will present some recommendations moving forward. Thank you.
Indeed. Thank you so much, Brighton, Dr. Oleno. And indeed, it's not only about the morgues. In fact, where you will be before you get to the morgue is also a very big problem, which is why we are going back to Roland and his team of panelists on the other side, where the discussions will begin proper on, the state of our hospitals across the country. Roland.
Well, we need to preface this, have a comprehensive outlook on the subject. And Eric will be joining me, and we're talking about Mawina, the popular name, Egbeta. And, well, it also means that we have to show you what really the pictures are in terms of just, citing some few instances of poor health facilities, because these facilities are where we have our health workers working. And you know that within the whole ecosystem and the environment of working, where you work is very important. It has a psychological effect on how effectively you are able to work. And it's very important that we do that. And so Eric Mawina Egbeta is ready.
And you're welcome here on TV3. We're having that conversation, all-important conversation on the country's health infrastructure, the systems, and essentially seeking to, amongst many other things, find solutions from all of the experts who are gathered here this morning. What we want to do for you is to set the base, the foundation as to what really is available when we talk of Ghana's health infrastructure, from systems, equipment to personnel as well, and their level of training in all of the things that we will be having a conversation on just briefly. And so what I want to do for you, just quickly, my task is quite simple, is to set that foundational base, and then the conversations can proceed. And so the latest is what we have on the screen right now, the health facility assessment conducted in the year 2022. And this is what was discovered after that work was done. A total of 9,505 total facilities we have in the country as of the year 2022, with the public institutions constituting 7,745, and then the private as well, 1,360. I'll break that down for you, and then you get to see quickly as well a much clearer picture as to where it all is and what more it is that we need to do. When it comes to all of these facilities, the 9,505, and the ability to provide antenatal care, we know that 85% of these facilities are able to do that for us as at 2022, with 67% of them being able to deliver antenatal care 24/7. Now, when it comes to surgical services, we know that 66% of these facilities can perform some surgical services in one way or the other. And then when we talk of bellwether, which goes a bit more intrinsic when it comes to surgical delivery, just 3% of these facilities, these 9,505 facilities, are able to do that. On matters of emergency care as well, there's 66% of these facilities which are able to offer some form of emergency care as well. And also very important, when it comes to full emergency, basic emergency and obstetric newborn care, 15% of them are able to do that. But let me just try and expand for you the 9,505 facilities we have in the country. Like I mentioned, 7,000 plus of them are public institutions, 1,360 are private, and then we know that in health delivery, the missions and then the Christian Health Association as well are pivotal in all of that, and that as well, 295. On the classification of our health services, based on this report, we know that 420 of these facilities are classified as tertiary, then 190 are classified within the regional status, 3,540 are district health centers, we know 3,355. Then the CHIPS compound, which is the basic, really, when it comes to Ghana's healthcare delivery service. CHIPS compound are believed to be the basics where persons can get quick emergency services as and when it matters most, particularly found in rural areas, amongst many other things. Let's proceed and then begin to break it down for you on service delivery as well this morning, as we continue to lay the foundation for the conversations expected this morning. Like I mentioned, 85% of these services or these facilities are able to provide some form of antenatal care or service to pregnant mothers. And if we move on to from antenatal care to deliveries, 71% of them are able to do that, which is quite great on the base value, and then 67% of them are able to provide this service 24/7. When it comes to matters of immunization, which is very important as well, we know that 85% of these facilities can provide some immunization for children. When it comes between the ages of 1 to 5, where more often than not the 6 killer diseases are often mentioned, we know that 69% of these facilities provide this level of care. Family planning, also very important. The important analysis and facts which were gathered from this 2022 assessment is that 97% of the facilities, over 9,000 facilities we have in the country, are able to provide some form of family planning services as well. We just want to move on quickly to staffing and then training services as well. Of all of the facilities which were surveyed and work done on them, we know that 58% of staff in a number of these facilities had received some form of training in providing antenatal care. When it comes to training for taking care of newborns as well, 45% of them have received that. Immunization and matters relating to child health safety as well, we know that 29% of the staff in these hospitals had received some level of training at least 2 years prior to the conduction of this survey, and then specialist care hovering around 57% of that. Let's look at facilities and infrastructure readily available. Isolation beds, what we found out from this 2022 survey conducted is that 38% of these facilities have some form of isolation facilities as well. Oxygen supply on the high side as well, 81%. But on the CHIPS compound level, averagely, that's quite on the low side as well. When it comes to transportation services, emergency, we know ambulances being able to transport patients when it comes to emergency services, amongst many other things. On the average, there is a not so great number of 48% emergency service availability in being able to transport these persons as and when they need it. Resuscitation, just 45% of the facilities have immediate facilities available. Now, lastly, what I want to provide details on is when it comes to budgetary plan for these hospitals to run by annually, just a paltry 23% of them had prepared annual budgets by which they were operating by. And if you read the report extensively, there are recommendations as to what must be done to improve this greatly. Also, annual audits of these health facilities, the 9,500 health facilities, 55% of them receive some external audits, amongst many other things. This is where it gets interesting. Of all of the health facilities which were surveyed in this report, 99% of them receive or take some form of fees at their outpatient department. And so a case of concern, because we know that the health insurance is expected to be working and is supposed to take care of some of these matters. And so it will be interesting to find out why we have as much as 99% of these facilities receiving some sort of fees. But when it comes to written guidelines in announcing to the person seeking care that we receive this amount or you pay this amount when you come to our OPDs, just 6% of these facilities had that outlined. And so that's just by way of quick data for you where we are. And then I can cede the floor to both Roland and Kamini now to properly begin the conversations.
And that's where we situate the conversation rightly. And I have to say that, well, we had Dr. Senanu Jokoto also right here, just do a bit part introduction, also joining me on the side of the divide. He rightfully, as a Deputy Chief Executive for the National Health Insurance Authority, also means that he becomes part of the whole conversation, because patient care, funding, and that rightful and important healthcare delivery, it's something all of us should be concerned about. But all the people who keep bearing the brunt, apart from the patient, will have to be the professionals. And I know that Madam Perpetual Ampofu also tends to represent them on the union side. But you take a look at the facilities that your workers, your professionals operate in, and I made an assumption earlier, or an observation, which is if your environment where you work is actually bad, it has a psychological effect on you negatively. And you're watching the statistics, watching the pictures, and what you already know. It's that bad, is that not it?
Thank you very much, and congratulations to Media General for initiating this conversation. In fact, it's been something we've been talking about for a very long time, and it's something we cannot stop talking about. So there's a good platform for us to continue the discussions. And indeed, we are nurses and midwives, we are doctors, we are pharmacists, allied health professionals, all working within the same space. And based on the figures you showed, if you look at the whole of Ghana, we are looking at over 9,500 health facilities with over 7,700 within the public health sector and the rest within the private health sector. When you take the health facilities, when you move away from the capitals, from the regions, go to the districts, and then move lower down to the health centers and CHIP compounds, these facilities are actually not in the best of shapes. Even with, for some of those facilities within our capitals, if you take even the regional hospitals and the teaching hospitals, it is not in the best of shape. You talk about the infrastructure, the equipment we work with, the drainage systems, the toilets, the disposal of refuse, and all those things are not in the best way that will actually help the health professional feel good in working in these environments. You mentioned earlier, or he mentioned earlier, the acting registrar of HEFRA, that when you enter a hospital, you should feel like you've entered a hotel. We are nowhere near that.
As if in your bedroom.
Exactly.
Well, there are some few facilities, or maybe at least one.
Yes, UGMC is in a good shape. And
UGMC is a hotel, actually.
It's in a good shape. Why can't all our hospitals be like UGMC? Why can't they be? And it goes back to the issue of resources. And mind you, the Abuja Declaration, which was signed on by all African heads of states, goes as far back as 2001. So it's 24 years on. And where are we? We are talking about 9% of the national budget committed to health. So successive governments have not done much when it comes to actually making resources available for the health sector. And indeed, there was a time in our country where there was GOG, government funding for health facilities. It stopped, and as we speak now, all our health facilities rely on internally generated funds.
IGFs?
IGF, exactly. That is why when he was showing the stats, you saw that OPD services up to about 99% needs to be paid for. So when you don't have the requisite resources, you cannot renovate, you cannot build on, and that is where we find ourselves.
We have quite lengthy time to do this conversation after 11:30 and thereof, and I know quite well, apart from you making the effort to play in the policy space, into politics, you also managed the Ghana Health Service for the Volta region. It also means that you're clearly doing public health administration apart from the combination for practice clinically. And I have to say, I have common examples of my own experiences. We have friends who move from, let's say, it could be the Tema General Hospital or one of those general hospitals we have around, and the next 3 months they move into some NHS hospital, and they tell you, what's the difference? And you will find that they bear testimony to the fact that the facilities that are in the West or in the advanced country seem to be orderly managed, and there seems to be a correlation between maintenance, funding, and then caring for the psychology as well as the environment of the health worker. How do you think we can get there, knowing what you know clinically and then administratively? Dr. Jogoto.
Thank you very much for the opportunity. And once again, let me thank TV3 and Media General for this opportunity to engage in this very important discussion. So you have hit the nail right on its head. I think you've started giving us the solutions to this very complex issue. Funding, sustainable and reliable funding. Yes, we all agree that health infrastructure is the backbone of service delivery. So if you look at the WHO Health Systems Framework, which is built on 6 core building blocks, service delivery is one of them. But in service delivery, like I've mentioned, is health infrastructure. Health infrastructure actually cuts across all the building blocks that we are talking about. And Honorable Mark Mewani has already spoken about the health workforce and the influence of health infrastructure. We can also talk about health information systems. We can also talk about essential medicines, vaccines, and technology. All this would require some very good health infrastructure. But to even get there, you have to look at the kind of funding mechanism that you have in place. That is the backbone of the kind of health infrastructure that we would have. I think we've already talked about the funding shortfalls. The Abuja Declaration is supposed to be 15%, but Ghana is doing between 6 to 8%, depending on which year you're looking at. The GOG support over years has not been very consistent. So if you look at the local funding mechanism, basically it relies on budget allocation from government and then the National Health Insurance Authority. And what systems do we have in addition to ensure that we have regular funding, a revolving fund for maintenance of these equipment and infrastructure?
That's very important. Why?
What kind of funding do we have for it? So I've been in the public health space, like you said, for close to 2 decades now. If you go to most of the facilities, they do not have any revolving fund available for maintenance of facilities and maintenance of these equipment. So we've seen a lot of brilliant, beautiful facilities coming up across this country. Ridge is one good example. It's one of the greatest facilities that you can see. UGMC you've talked about. We can talk about a lot of regional hospitals. WA Regional Hospital is relatively new. Upper East Regional all came up during the first administration of His Excellency John Dramani Mahama. You can talk about a lot of these district hospitals. But a few years down the line, when you go there, what do you see? So 3 weeks ago, the health minister did something that was very important.
Which is what?
He went to the Ridge Hospital and he highlighted some of these deficiencies. The CT scan, MRI not working, the washrooms not in really good shape. He went to Tamale, he highlighted all these. It's very important because this is the beginning of the conversation. I'm sure that may have even triggered this particular conversation. What can we do? So first of all, from where we sit as National Health Insurance Authority, we have to make sure that we pay realistic tariffs. Yes, most of these public facilities have internally generated funding, but majority of the funding that they have to run their hospitals is from NHIA reimbursements. So anytime there's a shortfall in that, then they run into difficulties maintaining infrastructure and equipment because there's nothing in place. So if we pay realistic tariffs, we do regular reimbursements, then they are going to have access to more funding, like the Honorable Member of Parliament said a few minutes ago. And when they have this regular funding, then they can actually plan for it.
Dr. Jishoko, what's your point with the fund? Are you saying that we have to pay more on whose side?
So we have to have realistic tariffs. And I can tell you, so I'm landing there now. His Excellency, the President, realized this gap. The NHIL has been capped for the past few years. When we say has been capped, that means the funding available for NHIA to reimburse these health facilities, has a limit has been placed on it. So whatever we collect from as from taxes that is supposed to go to NHIL for the health facilities would have been capped. So maybe you're supposed to get 100% of it, you are given 40%. I think that's the Act 947, I believe.
It has been capped. And
what's the percentage of the capping?
The capping is 85
of the annual collection.
85.
85.
Yes.
So what goes
15% capping.
15% capping.
Capping. Yes.
So 15% goes into the consolidated fund.
Yes.
Although only 85 goes to the National Health Insurance Authority.
Yes. Yes.
Okay.
No. I think it's the other way around.
That's the other way around.
Is it
more?
It's not the other way around. It started with about 66, but over the years
it's been increased.
So annually we've seen
good. So you see
an
that
incremental
shortfall.
reduction, so to speak.
Yes. So you see that shortfall. So
but the 50% is a very big figure.
I understand because of the volumes we're talking about. The
billions of cities. So last year, 4 billion was available to NHIA, and then this year it is projected that 10 billion would be available just by the commitment of the president to uncap the NHIL.
How does that solve the matter we're talking about? Where we're going to have our sisters who are having oversight responsibility coming from the association that is headed by Madam Perpetual.
Great, that is where
to
I'm
work
coming.
in a good environment.
So once it has been uncapped, now you can pay realistic tariffs. So as I speak to you, together with the World Bank and all our expert groups, we are having our final meeting to review the tariffs so that we can begin to pay realistic tariffs. Some of the postures that these facilities take is mostly due to adaptation. If they don't have funds to run the facility from NHIA or NHIL, they are bound to charge, as this is a matter of survival. So now when you pay them the realistic tariffs, they can plan for all the overheads, administrative overheads, infrastructure maintenance, and also equipment replacement, all these. So this would, medium to long term, have a direct impact on service delivery and by extension on all the health workers who are within our facilities within this country.
Right. Dr. Jokoto is a great orator, but also does his work as well. So the thing is, by experience, we talk well. How do we actualize these into plans committee? And that's a question as media people, communicators, we tend to always ask. When we're doing the inquisition, how do we actualize or not only verbalize, but also actualize what the policy indicators are, committee?
Indeed, Roland, let's have the conversation here. Bright is still here with me. Bright, you were with NGOs in health. You work directly with the people in the health sector, the facilities. You've had the conversation so far. I heard you earlier when you were talking about the capping, that is 70-20. Explain to us what you meant by that.
Yeah, so I meant initially it was 75-25. And as it was being alluded by our Honorable MP, it's 75 to the NHIL and then 25 to the capping. But we thought it was the reverse, and the 25% was, even though a huge money going into the NHIL. If you heard Dr. Jokoto well, now that it's uncapped, it's adding about additional 100% to that fund. If they were receiving about 4 billion in quantification at that time, and now it's getting to about 10 billion, then it's about multiple the fund already. So if the president has uncapped, it was a good news to all of us, meaning that NHIL is going to get more money.
Right.
That is giving them the energy to do the realistic tariffs he's talking about. And now we should be prioritizing what goes into health infrastructure. What is there for maintenance, what is there for equipment, what is there for personnel, and all that. And these are the things we are looking out for. And even the introduction of the Ghana Medical Trust Fund is also additional funding that is coming to the sector to support rebound or reset the health agenda altogether. And this is what we are looking out for as civil society, to see that moving forward, health infrastructure in general is not a challenge. As we all look at seeing facilities look like RAGE, look like UG, University of Ghana Medical School and all that, then it means even down to the district, our district level health facilities, those are the hotels we need to see. Because
district levels?
Yes. People at the district, if we start mentioning district, Bungo and then other places, none of them are going to travel to see UGMC and then RAGE. So the facilities they will be seeing there is their district hospital. Let me say that, yes, and apparently it's going to be the biggest referral facility when they are getting referral from the CHIP, the health centers, to that side. That led to the introduction of the NOPs, the Network of Practice Program, so that we see that there are unique facilities that are interlinked with the other CHIPs and then the health centers, and their personnel, specialists who are delivering service. So when we even talk about access, we are not looking at physical access, because we have the personnel who can deliver the services at that community level. So we are looking at NHIS with these resources, together with other funds that might be coming in our research system, to look at how we can get better facilities moving forward.
Indeed, Bright, I'm going to come back to you. We'll look at what prioritization looks like if, you know, the NHIS or NHIA gets all that money, where they should be put in. You've mentioned the district levels, but what would it look like practically? Let's hand the microphone over to Dr. Olenu. Dr. Olenu, many of these facilities will fall under the Ghana Health Service. Even the staff too will fall under the Ghana Health Service. You deal directly with these people and the facilities. Why are some of them so bad?
Well, you know, some of these facilities, sometimes we shouldn't forget about the human factor, because these facilities are managed by people. So why is it that sometimes you visit a private facility and everything seems to be doing well, but you come to a public facility, then our resources are not good? So it boils down to a lot of maintenance culture, and then we have to make sure that we have performance contracts with medical directors and facility managers, where the Director General of the Ghana Health Service is drawing performance contracts with the facility managers. He's expecting to see key performance indicators at quarterly visits to see if you are maintaining your equipment, if your wash facilities, everything is on point. Because you go to private facilities that provide some of these services and everything is going well, but you come to the public service, it seems like the maintenance culture. And also, we shouldn't forget that the human resource is not equally distributed. Some have more human resource available than others. So we also need to have very equitable distribution of human resource, so that we'll be able to address some of these key issues. So I think we shouldn't forget that the software components of the health system, people's values, their beliefs, and their attitudes towards maintaining things that have been entrusted in their care is very, very important if we have to maintain the state of our health facilities. Thank you.
I see. But this maintenance culture issue you mentioned, we know that there is a crossbreed between public sector workers, health workers, and then private sector health workers, which means that many of you who work in the public sector are the same people who work in the private sector, yet you keep things at the private sector better. Why is that a case?
Well, it's a very difficult one, but it's because, for example, let's assume a private person has invested so much money. So maybe should we say their supervision is more regular, or maybe they are very, they are ensuring that things are going very well. And also, you realize that maybe people are afraid to easily lose their job security. They are afraid to lose their jobs easily with private person, because a private person wants to make maximum amount of money or investments. They want to returns for their investment. So they will ensure that things are running properly. But as I said again, it shouldn't make a difference if you are a professional, whether you are working in a public or a public space or private space. If you believe in the inherent worth of every human being, it doesn't matter where you see them, whether in a private facility or a public facility, the same level of care should be given across. So if you are maintaining equipment, if you are working hard in a private facility, you should do the same in a public facility, because people access care from different levels of the healthcare system, and they should receive equal care, equitable care, high quality care. So we should stop saying that our public, because we work in public, we can do what we like. Things are changing. The Director General is really on ensuring that our health facilities are functioning at the highest level. Yeah.
Doc, I'll stay with you a little longer because I know you have practiced locally, prior to your appointment at the Ghana Health Service. Financing also means that you're unable to get the tools that you need. Poor financing, excuse me, also means that you're unable to get the tools that you need to work, the equipment that the hospital needs. In terms of the logistics of delivering health care, how bad is the situation for you as a practitioner?
Well, so as I said, it is variable. It's variable depending on where you find yourself. So we saw the Harmonized Health Facility report that was presented to us, realized that some places do have enough, some places do not have enough. And I mean, it's one of the gaps in our healthcare system. So that's why we are working towards equitable distribution. That's why we are working towards working with NHI to ensure that no matter where you are, you should have access to the minimum requirements. Yes. So I think for me, it really behoves on the practitioners to take good care of whatever equipment they have, because you realize people come to public facilities, they complain about broken down equipment, and then they are referred to private facilities where they get their services done. So what is it that we are not doing right in the public? Which means that we should change our attitude. We should be able to maintain our equipment, and then we should be made responsible. Facility managers should be made responsible for the maintenance of equipment in their facilities. Of course, we have budgetary deficits, but that doesn't mean the little we have, we shouldn't take care of them. Because you go to big hospitals, every now and then their machines are broken down, but the same private facilities are continuing to provide services. So maybe there's something we need to do, or something we need to learn from the private sector to implement in the public sector. Maybe it's hold people responsible, or make sure people are sort of not punished, but made to pay for mismanagement, because it's a cost to the nation and then it's a cost to the government. So we should take care of that here.
Indeed. When we come back here, we'll deal with the issue of accessibility and the quality that exists beyond the regional levels, beyond the national levels. I want to hand over now to Dr. Winfred Barr. He is the Registrar of the Health Facilities Regulatory Authority, HEFRA, indeed. And Doc will share with us what they have gathered so far on our health facilities. Doc.
Hello, thank you very much. So this morning we want to show you a few of the things we've gathered during our regular monitoring. I want to say that this is not a survey of all the health facilities in Ghana. Actually, just last week, the Honorable Minister of Health has asked me to do a survey of the state of all the health facilities in Ghana, starting with the government hospitals. So from next week, we are going to start that assignment. But earlier this year, we did a pilot study of some of the health facilities in Ghana. And then we concentrated on just the health centers and some chiefs compound. So I will take you through some of the findings. Just know that the higher levels are not part of this survey, and just so that we can tailor our discussions towards that. So we said we thank TV3 for this. So we have a legal mandate, the Act 829, the Part 1 of the Health Institutions and Facilities Act 2011. So we are supposed to register, inspect, license, and then monitor all health facilities in the country, both government health facilities and private health facilities. And this is key to achieving providing safe and quality health care in the country. So I will take you, just so that you understand what we are doing, I'll take you through the health facility types we have in the country. So we have what we call primary hospitals, we have secondary hospitals, tertiary, quaternary. Currently, we don't have any hospital in Ghana that has been licensed as quaternary yet. Then we have the CHIPS compound, the health center, infirmary, maternity homes, polyclinics. We have the general family medicine clinic. Then we have the laboratories. So for them, we also have laboratory diagnostic imaging. We have basic, primary, secondary, and tertiary. Then we have the specialist clinics like nephrology centers, cardiology, dispensing optician center, eye clinics, dental, psychiatric clinics, physiotherapy. We have the over-the-counter medicine shops, and then the pharmacies. These are the kind of facilities we regulate. So for the CHIPS compound, like we said, is the basic of our facilities in the healthcare delivery system. And they are very close to the people, especially in the rural areas. So for them, the minimum is a community health nurse, or an officer or a midwife. When you come to the health centers, so they are a bit more advanced than the CHIPS compound. There, it has to be manned by, the minimum requirement is a physician assistant or a nurse practitioner. Then we have the general family. So from the general and family medicine clinic, we have the medical and dental practitioners in charge. All right, so then we have the polyclinic, primary hospitals, secondary hospitals, and then tertiary. For the tertiary, that's where we have our national and then the teaching hospitals. And there are just a few, about 6 facilities have been licensed as tertiary hospitals. So I heard somebody saying there are more. As far as we are concerned, we have licensed only 6 as that. And they must provide specialist diagnostic care, complex care. To qualify as quaternary, you must start having organ transplant and the rest. So I believe that hospitals like Kolebu, UGMC, and Konfanoshi can apply for that. So that's our 2025 snapshot. Now, these are CHIPS compounds and health centers. So we looked at 112 facilities, 60 in the Ashanti region and then 52 in the Eastern region. And it's a mix of CHIPS compound, health centers, maternity homes, and then clinics. Like I said, currently, from next week, we'll look at all the facilities to teaching hospitals in Ghana, and then we'll let you know. But yes, this is what we found. That only 17% had oxygen cylinders or concentrators available. Some of them have cylinders, but no flow, the kits and then the max. Then only 25% met minimum staffing equipment. And these are health centers and CHIPS compound. So most of them, you have only one nurse managing the whole place. And that can be. Only 17% of facilities had fire extinguishers in good working order. And that is dangerous because when there's a fire outbreak, it's not safe for the patients and the staff themselves. Yes. 13.5% of facilities had functional resuscitation kits. And then 32.5% of facilities across both regions had functional patient washrooms, which means the rest, most of them are just makeshift washrooms, which are not very good. And then 40% of the facilities offer maternity services with complete delivery packs. They are supposed to have all of that. So I explained some of this, and so let me not go. And so let me show you some of the things we found. So you can see shafts. These are not supposed to be disposed in this way. We should have shaft boxes. But outside, so if somebody gets there, this is very dangerous. When you say shafts, what do you mean? I mean needles. The needles we use and the blades, yes. And you can see an incinerator for a health center. This shouldn't be. So this can even catch fire by itself. It's not safe. And look at some of them. So that's an exercise book for records. But these are how some of the washrooms. Yes. So that's supposed to be a washroom for some of the facilities we inspected in the first quarter of this year.
Which area did you find this?
So we'll not be able to mention names now, but we are taking measures on that. We are taking actions. So you can see some of the washrooms. These are real. So yes, you can see how dilapidated some of them are. Like, and look at some of the beds our people sleep on. So some of the OPDs, you can see their structures are not looking very good. Storage facilities, treatment rooms are not up to standard. Look at some of the beds, treatment room.
Which level facilities are we looking at?
So, like I said, we are looking at chief's compounds.
Chief's compounds.
And health facility, health centers.
Okay.
And these are mostly in the rural areas.
Where people need them the most.
Yes.
So with the poor Ghanaians, this is what you give us.
So this is what the state of healthcare in Ghana is. But I am sure that this current government is very poised to change the narrative. Infrastructure. So 46.5% of the facility did not have continuous supply of water. Some
Across
of them,
Ghana?
Yes. And 65% of did not have functional washrooms. We've talked about that. Fire extinguishers, very basic, it must happen. Bushes surroundings, poor lightnings, and deteriorating buildings were observed. Electricity, 41% of them did not have constant electricity supply. We need to look at that. So we need some backup power supply for them. Most of them do not have. But I put this one there because I want you to see just basically what I've shared. But we've added some data from 2024 that will let you see that as the facility becomes bigger, so this is the list, becomes bigger, things get better. So when you look at staffing, as you move to district hospitals, regional hospitals, staffing gets better. But at the lower levels, we have great shortfalls of staffing. Like I said, we will bring the higher facilities in our next survey. All right. So focal persons, so like I said, some of them, just a single midwife handling a place where you should have about 5 nurses handling. Okay. So those were some of the gaps we noticed. 59% lacked pharmacists. Some of them is the same nurses who dispense instead of getting technicians and the rest. Emergency preparedness, most of them do not have oxygen cylinders. All right.
All right. I think we have to put a... Yeah. So that also put the matters into perspective. And it's quite interesting. And that's a perpetual. Yes. Yeah. This is where you're... on our stream, I have Ajwa Sally, who says she currently is at a health facility, a CHIP compound. Yeah. And they don't have anything. You know, virtually, they have to double and do everything by themselves. And I have a medical doctor now. At the time he was a student, I met him in Beijing. Okay. All right. And he went to do his clinicals in the best Chinese hospitals. He currently is doing his post in Korea currently. Emmanuel Adepa Adapo is watching. I don't think
he will come back.
He will. When he came, so for example, when he came from China, you know, we have this rift where there's a pushback from the medical, where it takes time. So he went to the upper regions of Ghana to go and sacrifice. He even used aboboya and some of those things to be able to practice. He got recognized and then got to reach. Okay. All right. But at the end of the day, all the top professionals want to be in Accra. Yeah. I think that's right. It's like the lawyers and everything. And then those who don't get lucky, they'll go to rural areas. And they are handicapped by way of resources. Your own people. Okay. So how do we intend, one, motivating them to be able to work in these conditions? And two, how do we make sure that we equip them by way of human resource-wise or practices or skills to be able to manage what they have?
Great. So, indeed, it's very disheartening when you look at what we've just seen. But the truth is that that is the reality on the ground. And just like we've indicated here, At the district facility level and the health centers and the CHIPS, that is where most of our people can actually access first-hand health services before they are referred anywhere else. And if you look at the state and the numbers that we showed, you see that for most of these facilities, it's one nurse, a community health nurse who is there, or a midwife, or somebody who is standing in for all other professionals. And indeed, if you go to the hardest places to reach, the underserved, the typical rural, the deprived, it's a nurse that you find there who is working. Most of the other professions won't accept posting there because, one, look at the facilities we saw. Who wants to work in those facilities? And two, the social amenities there for educating your children and all those things, nothing is there. Who wants to accept posting there? So usually when the Ministry of Health and its agencies do the postings, especially for our cadre, it's very difficult for most of them to accept, pick their bags from the urban centers where they are and move to those areas to go and work. But at the end of the day, you want a job, you want to be paid monthly. So they take those decisions and move out there, go and rent homes that have, how do you call it? No, the worst of washrooms.
Not fit for purpose.
Not fit for purpose, but they go and live there just to provide services. Some have to cross rivers, wade through forest areas, ride bikes they've never ridden before, learn to ride them just to reach communities to provide services. So indeed, if we have these numbers there, helping to care for the populations that are there, then it's important that we care for them. We care for them by putting in incentives. We've talked about this rural incentive package for health professionals for a very long time. It has not seen the day of light. In fact, the light of day, sorry. The WHO funded a really crucial work that was done by the Ministry of Health to put these packages together for those who would want to serve in deprived or underserved or rural areas. All those categories were made, and it was a brilliant job. The packages were wonderful.
So they are in the book?
They are in the book. It's,
okay. So
it's
what
not
are the packages?
Well, if you accepted to work in an underserved area and accommodation was to be provided for you, you were supposed to get a top-up in terms of your monthly remuneration. You were supposed to receive some support for educating your children, some transport allowance and all of that, plus a limited or a shortened period for further education, for your promotion and all of those things.
Why didn't you guys implement it alongside the policy implementation?
Well, Ghana Health Service is doing a bit of it in terms of promotion and promotion out of 10 and in terms of study leave and all those things. So it is there in a bit, but not in totality.
I see.
But we need to do more. We actually need to do more.
So you acknowledge you need to do more.
We are not in the position to provide, but we can advocate.
You were a medical doctor, Dr. Nawani.
Yes,
okay. So then you became a mainstream politician, MP.
Yes.
So you empathize with your kind.
Yeah, I worked with the Ghana Health Service. That time, the Ministry of Health.
Yeah. Can I ask a question?
For 6-7 years, and I made up my mind to go private.
Great. Will I be right to say, when you are from practice and you come to the policy space,
yes,
and let's say the governance space,
yes,
you forget about your friends?
No, you don't forget about them.
Because you look very plush, and people in the rural areas who are also doctors like you and not MPs don't have their party.
I built an 80-bed capacity hospital before coming into the public space. And I also have a 40-bed capacity hospital at Wasekropong before coming to the public space. I operated a school before I came to the public space.
I understand that. I'm saying that...
I had a lot of things, actually, before
I'm not talking about your personal possessions.
Yes.
We're not doing asset declaration.
No, you said
I'm talking about pushing the policy towards its implementation stage, where you have seen practice clinically,
yes,
and then let's say health entrepreneurship, you are there as well.
Yeah.
And so I'm saying you know the real issues.
Yes.
Maybe for you and those who tend to manage policy, let's say at the governance level, why is it difficult to translate your own experiences to improve a sector?
And that is what I'm doing now. Honestly, it is the dissatisfaction with what I was seeing at the consulting room that moved me into the space. Yes, because I realized that I couldn't provide for practically everybody who came there, had no money. You know, we had a policy that take care of the person before you even ask for money. That was the way we were able to establish ourselves in Dunkornofin. And after that, the patient would not be able to pay. And indeed, throughout my 25 years in private practice, I never sent anybody to court. Because when you see a person who cannot pay, you just know that this person even do not have the money to pay. And it is this issue that brought me out from the consulting room to this space that I find myself. And what I've realized is that, honestly speaking, first and foremost, we need to find a way of managing our staffs. What we are talking about, that when you come to Accra, you have got a lot of staff, you go to the rural areas, I mean, there's lack of staff and the rest. We need a tier of motivation. And to be able to do that, we need resources. And I'm saying that people, look, a medical doctor will agree to go to anywhere. The family is there, but he can leave his family in Accra and go. If only one, where he's going, his skill set is not going to diminish. In other words, if he's a surgeon, if he goes there, he should be able to do operations. You know, he should be able to carry out those diagnostics that will allow him to diagnose certain cases and be able to operate on them. That is the first thing. The second thing is extra income. And that is where I'm talking of the lack of managers at our hospitals. We lack healthcare managers at our hospital.
Okay. So in effect, you're saying that a medical professional should not necessarily translate to being a good administrator or manager.
Yes, you need further training. Back in Canada, for example, now it appears if you don't even have an MBA in healthcare management, or there's also Masters in Health Administration, if you don't have these two qualifications, you know, you might not be able to head a hospital. Or if you're heading a hospital, then you've got to go for that training. And it's quite expensive. You need to be able to know which, for example, which diagnostic services you have to outsource and which ones you've got to maintain. If you are getting a lot of requests for X-ray services and you don't have an X-ray machine, you are losing income. And that is what is happening.
Okay.
If your what do you call it? Your CT scan. You go and buy a big CT scan, and the whole year you carry out 2 or 3 or 5 of them. You are losing income.
I see.
Because you've locked all your money inside a CT scan that might cost hundreds and thousands of dollars. And
is that why you guys like outsourcing? Those who, I'm not talking about you personally, those who are at the health facilities
it has to be
publicly, they outsource, and you find that 50 meters away, the private
you have to take
outsourcing
all those
agents are there.
decisions scientifically.
And they tell you that go to, for example, you go to the Tema General Hospital, just 30 meters away, you have the service providers there. But the hospital itself cannot have it.
Yes, you go to look at the request that is coming to the hospital. The total number that comes to the hospital as against buying that equipment.
I don't understand. I don't understand.
If, for example, in a month, you are getting only 3 X-ray requests.
Do you buy a whole machine?
You buy a whole machine.
Thousands of dollars. That's your argument.
Yes, that's my argument.
All right.
Okay. But what I'm trying to say is that, you know, we really need managers to be able to maintain some key staff. A manager knows how to handle the different type of staff that he has got. And that is what is lacking in our hospitals.
Okay.
Recently, we went round on an outreach. I mean, you go to...
you mean the Parliamentary Select Committee on Health?
Yes, the Parliamentary Select Committee went on an outreach. We we got to, let's say, Bolga, for example. Their CT scan has broken down. There's no biomedical engineer. They've not used that machine that much. They can't repair it. Now they're asking the Ministry of Health to bring them money to come and repair. Rich is possibly would want to do the same thing. They also have their machine broken down. Who buys for who and who will use and who will come and repair? This is a question that we have to ask ourselves. It's very, very genuine.
Okay.
I mean, the Ministry of Health will buy for you, you use it, it breaks down, then the Ministry will come and repair. Even there's a suggestion somewhere else, somebody wants to come and repair it, then he will use it, retain 80% of the income, and give the hospital 20%. These are suggestions that we had.
When he did not buy the machine.
When he did not buy the machine. So the problem is what we have at the moment, at least at the district hospitals, and at the regional hospitals, and at the teaching hospitals, we should have managers, real managers, who will go and sit down at the laboratory, look at the flow of patients, and immediately identify that, no, there's a problem here. Let's increase the staff by 2. Let's make sure that somebody is sitting over there to carry out some activity and ensure that it operates.
But the reality too is that when you speak to practitioners, especially the senior nursing officers,
yes,
who are under the umbrella of the Midwives Association as well, and the register, they tell you that you're the doctors.
Yeah.
You think that you know everything at the hospitals. That's the reality. And even though the nursing practitioners have the best experience and the most experience and care, and even have the expertise, you will not allow them. You think you should be the administrators, you should be the superintendent, you should be everything. So perhaps you should be pointing the fingers at your own people.
No, even in the church, there's politics. You see, these are internal matters.
I don't understand.
I'm saying that even in the church, there's usually some form of politics. So this, when I say politics, I don't mean the partisan politics, but
internal politics of health administration.
Yes.
All right.
But a good doctor is trained to listen more.
And a good nurse is trained not to listen more. Is that what you're saying?
No, I'm only trying to defend my kind. Yes. Because when you listen more, before the person will finish speaking, you've already gotten the diagnosis or gotten something close to it.
Teamwork is very important in all of this. And we must recognize the role everybody has.
I like the pushback.
Yes.
So
it's very important. Teamwork, very, very important. Training, very, very important. Let us not confuse medical training with management training. There are two things. And so when you acquire this, you try to also look for that. And then you blend it. How to manage human beings, human resource management, project management, all these things are all part of building the human being up.
Just a few follow-up questions. Dr. Nawani?
Yes.
Just a few follow-up questions.
Yes.
You went across the country to inspect these health facilities, which tells me that the pictures that we have seen from HEFRA are not exactly new sights to you. What have you done since then?
Okay, we are currently compiling our report, and we've got to have a meeting with Ghana Health Service. We've got to have a meeting with the minister and start a discussion. But we've already seen that the ministry is already making some changes here and there.
What changes are they making?
They are supplying some ventilators to the Tamale Teaching Hospital, that type of, things that we discovered when we went round.
No, but
and apart from that,
we know that the Tamale Teaching Hospital is
the human resource, the managers, I think that they are changing them around to see. I don't know what is triggering that changes, but I think that they want some form of a little bit of a shake-up in the management of the hospitals.
Oh, but I can tell you that two things.
Yes.
The changes in leadership, we know it has become a norm that once a political, the political hands change in terms of governance of this country, some key health facilities, the heads there also go. So we cannot say that it is linked to the need for efficiency at the hospital, as you have described, that we need people with management skills to be able to do that. I'm also not saying that the people who have been appointed do not have management skills. That's number one.
Yes.
Number two, on the subject of Tamale, it is only after the incident that took place between the minister and the staff of the hospital that the minister decided to supply Tamale Teaching Hospital with those things. Now, while those things are important, it's easily to also conclude that it was tokenism to ensure that peace is restored, and the peace has been restored. So it's essential to put it into context and perspective so that we know that really there isn't much being done yet. Of course, this is a new government and there's much more time for it to do what it's supposed to do. And so I want to understand from you, your report, when you have your meetings and your discussions, then what?
Yes. We're supposed to meet all the minister with Ghana Health Service and other things. But let me just tell you that as a committee, we think that the hospitals can make more IGF. And even during the budget hearing in Parliament, the areas where there were reductions of their budget, we realized that the amount that was stated for IGF was very small. That is the internal generated fund. And when we questioned the finance ministry, or the representative of the finance ministry there, he said that they want to observe their IGF for 6 months before they release that amount, or before they agree to their stated IGF. So as a committee, we are, in fact, pressurizing the various hospitals to increase their IGF. And I believe they can do it. The reason why I'm saying this is that gloves, whatever they call them, medicines. When you go and you prescribe for the person to go and buy outside, you are losing revenue. And this is happening in most of our hospitals. Because NHIA will not reimburse you less than the cost price. Or even in such cases, there is a top-up payment that they do. So if you tell the people, go out, buy your medicine, go out, do your laboratory, go out, do that. These simple things that are done at hospitals. And you ask the patients to go out and do it, and probably somebody in the hospital is benefiting from that, then your IGF will go down. I've been running a hospital for 25 years, and now, I went into private practice 25 years ago. Yes, and so I know that these simple things that I'm talking about, if they can implement it, they can increase their IGF. And we're talking of money. The government of Ghana is paying their salaries. Ability to pay is a problem. That one, whenever you want to talk about it, we have to understand that there's a problem with that. And that's why we have got nurses at home, doctors at home, and they can't get financial clearance. That is the issue. We need them at the hospitals, but they can't get financial clearance. So looking at the government sector alone is not going to work. We now need to attack the IGF. We need managers.
Indeed,
to look at the size of the assets that they manage. If I had that size of assets, I believe that,
as a private health entrepreneur.
Yes.
So why do you think they are failing? Your colleagues in public sectors?
They are failing because they are not looking to make money. They just want to maintain the system.
But, Honorable, I want to say this. See, it is every government's responsibility to provide public services, including health, education, and the rest. So when it comes to the public sector, the idea shouldn't be about making profits, but providing services. We must put people before profit, especially when it comes to public services.
No fight.
Understand, understand the management and leadership of it.
Ask them to bring a book that has their bad debts. Their bad debts. When I say bad debt, people who have absconded without paying.
Yeah.
And have you ever looked for that book?
Absconding is a practice that doesn't start today because they cannot pay. They leave.
Okay. So Dr. Awani is speaking as an we like embellishing. He's a businessman.
It's negligible.
He's a businessman. We like embellishing. So he's a businessman.
They run away with it.
And he's saying if he is giving, let's say, the rich hospital to manage, it is his assets. And if you look at the financial statement, for example, you know what your assets and your liabilities are. You look at your ratios.
We have been going to the hospital.
And he's saying that
we have been going to the hospital.
And he's saying that you make sure that he cut down operational expenses or overheads, and then increase his revenue, and then you net it. His profit is going to be there.
And motivate yourself.
So I have
maintain your structure.
I have a very simple question.
There are countries in Africa that are providing free medical services for their populations.
Yes.
So what are we talking about? We need to improve the economy to be able to do that. I'm not even talking about Western countries or high-income level countries. I'm talking about African countries that are able to do
Northern
this.
Africa.
Botswana, South Africa, and the rest. So what are we talking about? We want to burden the population with a lot of taxes.
This is not a goal scoring for you. But so let's relax. It's just a public discussion. All right. So then we have to ask. Dr. Jokoto, I want to come to Hefra because one of our regular viewers, Brenda, has sent us an important message for Hefra. Just shortly, in 2 minutes, why is it that health facility managers in the private sector are able to manage their hospitals within what they get or collect as revenue, and then be able to improve the state of those facilities, and those in the public sector are not able to? Don't tell me about public service and all. I mean, because all of them collect some revenue. Yes.
Thank you. It's been a very interesting discussion. But I'll answer with three main branches. First, leadership. Leadership commitment is extremely important. When you go to hospitals, you have the hospital management teams, and it's not only doctors, nurses, pharmacists, administrators, and all that. Then secondly is the governance. So you need all your protocols, your guidelines in place that will facilitate good management. Then third is the enabling factor. I think this is where the difference is. I bet you, Roland, you can bring somebody from the Syracuse Business School or John F. Kennedy School in Harvard and drop them maybe in Quanta District Hospital. That person with the same enabling or the same environment at present will not be able to deliver the results that you want. You look at the two models, public and private. Private has a different business model from the public sector. So you cannot really compare both. One is profit-oriented. One is more like public goods, public service. It's supposed to help government to achieve universal health coverage. Therefore, finance cannot be a barrier. But for the private man or the entrepreneur, he is working at maximizing profit. So although he's contributing to the universal health coverage, his priority is to make money. But same cannot be for the public facilities. I'll not hold brief for them. But I can say that the contribution of their leadership expertise to the outcomes that we see may be less than perhaps 20%. There are so many other factors that we should not lose sight of. If not,
will go and come back here, maybe by the next year. Because you look at most of the medical superintendents, the leaders of these facilities, they have the experience. Even before you get appointed, you must necessarily go for, you must have some of these leadership and management certificates. So they are not novices put there. So there are so many other factors that we ought to look at. But let me reiterate again, leadership, the right governance structures, and the enabling environment. We should look at all these.
So the problem is with the enabling environment.
Enabling environment, that is absolutely critical.
The stifling environment. Why is it that you, so for example, I know you want to react. Yeah, no. So we go by the questions. Brenda, who is watching us, says you guys, and you guys literally means HEFRA. You're supposed to be monitoring these health facilities. Does it include public?
Yes. Well,
you don't close them down, Dr. Ban. Why?
That's a good question. I was really waiting for that question.
Because Brenda is worried. So you just don't close them. You just let them free flow.
So ideally, what I've shown you, if they were private, they would have been closed down by now. But let me tell you, we are not supposed to discriminate. First, our act was established in 2011. These are Ghana Health Service facilities. Most of them have been there for years. So since the act, you can't go back and say you are closing them down. We can only push and make sure that they adhere to the standards. But in so doing, if a facility is still not adhering, the law mandates us to give them a fine, or we can close down the facility.
Irrespective of public or private?
Yes. I'm sure you heard in the news some years ago, they wanted to go and close down some part of Kolim. And I can tell you that this current dispensation, we are taking that mandate serious. Whether it's government or private.
I don't understand. You have the balls to close down a public facility?
No, so we are going by the mandate. But you see, sometimes we also have to add some human face to it. If you have a health center in a hard-to-reach area where you need to cross a river before you go, that's the only health facility provider in the area, and you go and close it down, you cause more harm than good. So sometimes you have to add the spirit to the letter. And that's why some of these things cannot be closed down now. But I want to say that the HEFRA is going to carry out its mandate. Already, I've been there for about 6 weeks, and we've been able to close down a few facilities.
All private?
All private.
How many?
Oh, we've closed down 4 facilities. So
all private?
All private.
But you've done nothing about
we
the
have
ones.
started, so let me say, there's been an issue. The CHIPS compound and the health centers, you know, they are in evolution. So currently, 2 weeks ago, we've started registering them and licensing them. So by so doing, we've given them some of the things they need to put in place. I've met the Director General of the Ghana Health Service. Something like the fire extinguisher, you see, only 17% have. They've started the procurement process, and they are getting the fire extinguishers for all those places. Don't forget that CHIPS compound and health centers, they are very strategic to achieving primary healthcare and then universal healthcare. So we need to be very cautious in applying the laws there. But I can tell you that what we are doing is putting in place measures to improve them. And the Director General of the Ghana Health Service is very committed to improving those. And the Minister of Health is also very committed.
Okay. I have this one from a very experienced medical doctor. Dr. Adai, thank you for this. He says, why does government second doctors and nurses to CHAG facilities, but doesn't do same to private facilities, who by HEFRA's report are doing so much for the country?
Yes, so I think this is a matter of policy. So we've seen the Christian Health Association or the mission hospitals, they are providing humanitarian service. And government saw that one of the ways to support them is to give them human resource to help them. Rather than giving them money, we can give you human resource, we pay them, and then they offer service. For private, I am not sure if that is on the table yet, but I'm sure MP will look at it.
Roland, I can come in.
Yeah, no, Kebini, okay, wants to have a round and then we'll come.
No, just 30 seconds before she comes in. So the tariffs that we pay for public is different from private. So there's a markup for private facilities because government does not give them staff and equipment. So that markup is supposed to take care of that shortfall.
Sure, thanks.
All right. Cam.
I see. Indeed, Roland, we've also been joined on this side by Dr. Andrew Mensah, who is the Greater Accra chairman of the Ghana Medical Association. Doc, you're welcome to our National Forum on the State of Our Health Facilities, Reimagining the Future of Healthcare Delivery. If you're just watching us or joining us on television, you're welcome as well. Indeed, indeed. Doc, so perhaps I should come to you because a lot of things have been said. Sometimes the management of these facilities lie with, members of your association. You are the people who go to the ground, the CHIPS compound, the health facilities, nurses sometimes. Nurses mostly, excuse me. So, Doc, from all that you have heard, what have you gleaned and what's been your thoughts through the entire conversation that has been had so far, just before we get into some specifics?
Yeah, So far, I think I'll go by what Dr. Jokoto said. I mean, leadership is very key, governance, and probably the one at the bottom probably should come up. That's the surrounding environment, the surrounding circumstances. And he gave a very good narrative. Bringing a doctor from wherever, you drop the doctor in our context, I bet you the results will be the same. So, and I heard from the HIFRA presentation, it was a good one. And really, it's not new to us. We probably must all put our hands to the wheel, okay? And we know what has to be done is the will. We probably must all put our hands to the wheel, okay? And we know what has to be done on board. So this here representation. Greetings, Dr. Frank Srebo. Thank you.
The will will be on whose part? On both sides. So let's talk about your will.
Yeah, so our will is to desire to, get results. If you're a manager and you are, put in charge of a facility, even if you are not giving KPIs, you must develop one for yourself and satisfy yourself that within the mandate and the period given, this is what you've been able to achieve. On the other side, I think from the government side, they know what to do, and I believe they are on it. Sometimes they're a bit slow, though. And what's important is that, facilities work in different contexts. So they better come down, meet with the facility heads. The generality is there, but, deal with them according to the levels and the facilities in question. And I believe that we'll be able to get somewhere. Thank you.
I see, Doc. One of the things that has come up in the course of the conversation is why, our health workers, it's why our health workers, they work better in the private sector, they manage better in the private sector, yet in the public sector, it's not the same. And what we hear a lot, and I'd want you to react to that in particular, is that many of you intentionally run down the public facilities just so you can direct them to private facilities where you work or even own. What truth is there to that?
No, I wouldn't, agree to that assertion. No one would want to intentionally run down a facility. I mean, somebody is in charge, and it's the person's responsibility to know how to retain their workforce. As for the people working, you have got to manage them, okay? And there are pull and push factors. I mean, everybody will want to go to where they are comfortable. As what that means, it's obvious to all of us. So I'm still, hammering on leadership and the governance structure. If you would allow your staff to do what they like, then of what purpose are you there as a manager? People can be checked, okay? And so everything, begins and ends with leadership, as they say.
Yeah,
all other things are effects.
And yeah, I'll come back to you, but let's pick Bright's thoughts. Bright is with NGOs in health. And you can take the microphone, Bright. I'll come back to Doc a little later. But Bright, we responded a lot to some of the things we heard on the other side. So let's hear your thoughts on the discussion so far.
Yes, so I don't much agree with the some of the discussion, especially from Dr. Nawani, in terms of the what the private sector can do and the public and then the IGFs. You know, the public sector can get a lot of IGFs, but there was very low awareness on what go into that. So if the patient is asked to pay for labs, pay for this, pay for that in the same facility, and then NHIA says he's supposed to cover all that. If you ask a patient to pay for CT scan, and he doesn't know NHIA doesn't cover, it becomes a case. And they would have to run to NHIA to tell them, government is charging us for everything, but I say everything is free. So they should intensify some kind of awareness for us to know what is paid for, what is not paid for. Then the public sector can begin to generate some IGF to do other things. So you bring in the scans, you bring in the lab equipment and other things, and you charge. The patients are aware. Publish the rates. They will not do at the public sector. So they will even not prioritize what they would need, they will use the IGF to do. I don't know how they spent their IGF. These are some of the challenges we honestly have. So you generate a lot of IGF. What are the prioritizations within that fund? What does it go into? Do they charge maintenance fee or not? Does NHIA reimburse them with maintenance fee or not? But if you go to the private facility, you look at your bill and all those things are there. Even in the schools, you pay for your war school fees and they will say this is school fees. So little. They are charging for books, maintenance fee, that's that. They will do the breakdown and you have no objection than to pay. But in our public sector, everything is lumped together and they don't know which is paying for what. So I was diagnosed malaria, and everybody would think that, oh, for malaria, NHIA will cover. So at the end of the day, if you say go and buy this within the same facility, then so there should be a lot of education within the sector. And you know, a maximum, the population, the highest population are entering the public. And that is where we have the experts. That's my challenge. That is where we have the experts. But
the health experts.
Yes, that is where we have the professionals, the medical experts, the nurses, the professional nurses and doctors. They are the same people who are there and then do their side private work. So they are the places where we get the best of healthcare. Just that we have the quality issues and some management issues. So I also agree with Dr. Jokutu that the governance and then the leadership issues.
Governance and leadership.
Yes, so within the governance policies, what is there for them to do? The I don't care attitude is too much. And then maybe some opposing powers would also reach out to them, do this, don't do this, probably for some political reasons or something, also draws them back. People want to maintain their leadership positions, so they would not want to touch what the policies has asked them to do. There are some challenges that are hindering our public sector.
I mean, I'll quickly come back to Doc then. Bright says, I don't care attitude is too much in the public sector health facilities or management of our public health facilities. He also mentions, you know, the issue of governance, reiterating essentially what Dr. Jokutu mentioned earlier. Why don't you care?
No, it is not about we don't care, but you see, if you complain about one problem over and over and over again, and that becomes problematic. Especially when you are complaining about, you may put it so, but when you are complaining about an essential equipment, which has to be fixed, and it's taking forever, and you have to write memos, you know, prompting somebody. What is being is that, I mean, the one managing probably not interested. Is that what it is? And so maybe you may interpret.
Is that what it is? That they are not interested?
Sometimes that is what it is. The response don't come as quickly as you expect. And you know, the kind of work we do, you have the patient on hand. You are confronted with what you are seeing. And so you want it fixed within a reasonable, you know, time frame. But if that is not done, what else can you do? Yes.
Innovation.
Well, and that's where we innovate. You can see there's a lot of improvisation in the system, a lot.
Like what?
But we are moving away because the patients are now demanding what is expected. They know now the standards more.
Right.
And that's why we are also now beginning to say that provide this. Otherwise, we are unable to provide optimal care.
But so it brings me to the question. can we confidently say that when we go to CHIPS compounds, health centers like we have just seen, or maybe slightly better than we have seen, can we confidently say that we are getting quality, efficient health care, so that if my grandma goes to any of these facilities, she's not going to be misdiagnosed by an angry doctor or nurse because she's, first of all, that person is not well compensated, and the environment in which they work even tells so much on their mental health.
Okay, so regardless of your challenge, you're not supposed to get angry. In fact, the patients are the very reason why we go to work.
Doc, it seems you haven't been to some facilities before. Some people are just angry for no reason. And is it not because of where you work?
Well, probably that's why the manager have to manage them. You know, we are individuals, we have various limits to which we can stretch in terms of what we face as an environment. So that, again, I leave it to management. But basically, we are looking at universal coverage. The facilities offer care at various levels. So you can't compare what is done at the CHIPS compound at the district level to what happens at the regional level. That we must get it clear. But then the channel is there for us to escalate when need be. And all professionals have been trained along those lines to know that your grandmother who has come to this level really will get a better care at the next level. And that, I believe that the government is doing its best. I mean, all governments anyway. Okay, but with regards to our attitudes and then the rest, probably it boils down to
We'll pick up
management.
the governance issue, and then I'll go to Dr. Olenu from there. But on this issue of the state of being of health workers, I want to push that to Madame Perpetual, because many of you nurses and midwives have direct contact with the populace at the very basic level. Now, you have been attracted, courted with very nice things. You've gone to the villages, but the environment in which you work, you know, it doesn't commiserate. It doesn't commensurate with the work you're supposed to do, you know, so you're unable to deliver properly. Does it sound like a trap?
Let me say this. As we speak at the moment, there is no particular incentive package that attracts and retains professionals, or let me say nurses and midwives, to underserved, deprived or rural areas. There's actually nothing like that. If you look at some of the policies of the Ghana Health Service as the biggest employing agency, you will see snippets of those things. And I mentioned like steady leave and then promotion, but that is it. So there's no big package that attracts you to the rural area. If a nurse or a midwife accepts posting, the person wants to go there and work. In fact, the facility has an impact on you in terms of your psyche. Once you wake up every day, going there to work. But I can say this for sure. Ghana Registered Nurses and Midwives Association, from 2020 till date, we've been having our awards in December of every year, and we look at awarding at least 10 nurses and midwives who work in the typical rural areas of the country. And we don't just call them to award them, we send our media committee there to do documentaries on them in terms of what they go through on daily basis to provide services to the people. And one thing is very clear, those who emerge as awardees, it's more of the passion, the innate passion to serve the people. And they've been there for up to 10 years, and they put in applications for steady leave. Sometimes they don't get it, but they resolve to just stay and work because of the love of the work they are doing and the people they are serving.
But I can't imagine working in a place like what we have seen. So what is the state of the mental health of your nurses? And the nurses we go and meet at the basic level, CHIPS compound health centers, when they have to work in conditions like that. Is everything okay?
It is not okay. It is not the best. I have visited areas where it's raining and the facility in which the professional is working, water is dripping from the roof. There have been instances where storms, high winds have swept off the roofing from some of these facilities. And there are instances where services are being provided under trees, under sheds, and all of that. But one thing about us is that we know we wake up every day because of our patients. We go to work because of our patients. We have targets to meet. We have work to do. We have job criteria that is guiding us to do our work. And when we wake up, that is what we want to do, no matter the circumstance. And I know they are there and they are looking up to us to advocate for better working conditions for them so that their conditions can improve. So this platform, like I said at the very beginning, is a good platform. We should be looking at, for me, 4 P's in all of this. The places where the infrastructure, we are talking about the infrastructure, how to modernize, how to maintain, how to renovate these places. Let's talk about the second P, the practitioners. How to motivate them with better conditions of service. How to ensure that they have the requisite skills by ensuring continuous professional education, by ensuring that they get the specialty skills that they need to be able to work in such places to help our people. Let us ensure that the next P, the processes or the procedures one needs to go through to receive services are made much easier. How can I get to a place, you've diagnosed me, I need to do investigations, I need to run across to other places to go and do these investigations. Why can't we have services within the same place? I walk a few steps, I can get my x-ray done. I walk a few steps, I can get my scan done. I walk a few steps, my MRI can be done, and all those things. We must make it easier. We must also ensure that at the end of the day, payments doesn't become a burden for any Ghanaian who is seeking health services. That is the tenet of the universal health coverage, to ensure that acquiring health services doesn't become a financial burden on the individual. That is why the invention of the National Health Insurance Scheme was brilliant. But it is burdened with its own challenges. Removing the cap is good, but at the end of the day, can we be certain that indeed all the monies that has to go to the National Health Insurance Authority actually gets there? Because it's still going to run through Ministry of Finance. If they divert some of the money for other things, what happens? But we have had some of these conversations when we're talking about dialysis for our kidney patients and all of it. And we heard the National Health Insurance say if we uncap it and all the monies come to them, they can actually provide a lot of these services and ensure that the non-communicable diseases that is skyrocketing in Ghana and we are having to deal with all these things can be actually reduced and prevented in our health setting.
I see. So, I mean, in addition to all of these, would be the need for some of these facilities to be upgraded.
Exactly.
Some CHIPS compounds should no longer be CHIPS compounds. Some health centers should no longer be health centers, which means that the government of the day would have to find money to do that. And that brings me to Dr. Olenu. As NDC control program, you will need these facilities if you are to implement any of your programs or outreaches, so to speak. But look at the facilities you'll be working with. Is there any plan to improve them?
Yes, of course. I would say our Director General is committed to ensuring that people have access to good quality services wherever you are. And so if you listen to the presentation, Dr. Bandi, you realize that we have different levels of our healthcare system. And at every level, there's some expected services, yes. So maybe a CHIPS compound will not change to become a health center, but it should be supported to carry out its mandate of health promotion prevention, yes. So the harmonized health facility assessment that was done brought out all these challenges. So we have to go back to the data. We have to look at what the gaps were and then start filling those gaps so that they can function at their maximum capacity. So we don't need to do anything. We just need to make sure that the reports that were produced from these surveys have shown us where the disease burdens are and where the places that are not ready to provide the services. And we need to know what we have to take there to enable us to provide those services. Yes, so we need to provide some places which have obsolete machines with proper BP apparatus, glucometers, etc. Because I walk in, I want to check my blood pressure, and your machine is not working, or it's not even standardized, or is obsolete. I will not
or do not have at all.
Exactly, or do not have at all. So we need to make sure that we support such places with the equipment. And also, as I said before, facility managers have a mandate. You see, when you are supplied with those things, it doesn't mean you should just wait for them to get spoiled, and then you have to have a maintenance culture. So the Director General is ensuring that if you are a facility manager, they will have a performance contract with you. So they will come around to see if you are maintaining your equipment, if you are ensuring, because our access to good quality and equitable healthcare depends on the infrastructure. So if you are not able to provide all these things because you have a broken down BP apparatus, or you can't measure someone's glucose, I mean, it's not something that's very good. So the data should enable us to fill the gaps and look at where the disease burdens are, and we act appropriately.
I see. Dr. Mensah, it would appear that the issue is back to GMA, to the GRNMA, in terms of managing the facilities, Are we shifting post?
Not at all. We are not shifting posts. As the president of GRNMA said, it's a teamwork. And at any material time, we all got to sit down as a team and see, and review what our roles are, so that ultimately the patient gets the best of care. Being mindful of the fact that we ourselves are also potential patients. We've always had that at the back of our minds. And basically, that's why the conversation is going around the same management. Point. And so I'll reiterate the fact that even though we are sitting here representing different entities, different groups, ultimately we are one group. And that's where the message must go. I've got to know what the challenges of the nurses are. They've got to know what mine
so
and
if the doctors are
together.
failing to manage these facilities, or the health workers are failing to manage these facilities, should we start to bring in, like Dr. Nawani said, someone with a management expertise to manage the facilities?
Not necessarily. Have we found out why these doctors are not, achieving what they have set out to? Yes, I am. But I'm not a health manager. I can only, guess.
But you have a health manager.
I have one.
Why do you think that health manager may or may not be failing?
I need to find out from him, but I guess he might also have some constraints, okay? It's after that before I'll be able to say, specifically and boldly that, well, you are at fault or not. You might change the headship. I don't think necessarily that may transform into, if the problem still persists, if that kind of environment still persists, if they will not be allowed, room to do what they think has to be done, okay? So it is not as simple as that.
So it's not, well, it looks like on the other side.
I'm even interested in asking a question because I'm looking at the set of questions on Facebook, especially where we have the stream, apart from YouTube. Very interesting comments there. So I want Kemini to ask Dr. From the Ghana Medical Association. Okay, Dr. Is it possible that some of your members who work in the public sector, okay, health professionals, whether they are doctors or nurses, also own health facilities that look better and operate better than those that they work in the public sector?
Situations.
Okay, so they have their own health facilities they operate, but they operate them better than where they work in the public sector?
Yes, and that actually is not proper for you to be conflicted in that manner, okay? And that should be checked for you to own your own private facility and also work in the government facility where you run yours better. In the first place, you might not even have the time, to run both effectively. And you realize that in most cases, it's the government facility which suffers. So,
okay, so you're talking about the moral and ethics.
Yes, that's where I'm coming from.
Just talking purely on governance and management.
Yeah, but probably it shouldn't even be allowed in the first place because you cause a problem and now you have to go and solve that problem.
Then I had an experience. A friend of mine, Jim, may so rest in peace, died. We all took him, I was there, we all took him to the health facility. He had an asthma attack. And the private health facility saw that, I don't know what happened to their oxygen. my friend was dying, and so they said we should quickly transfer him to the Tema General Hospital. So we didn't, there was a lot of traffic from Fienya to get to Tema, and so he died at the hospital. Why is it that your friends who own the facilities, your colleagues who own the private facilities, they brand and operate as the best private health facilities, but they never want to record casualties? They always want to dump it at the public sector. Why?
Okay, it's not as simple as that. In fact, if you have to transport, I mean, it's not a crime to transport a patient from one level to the other. And what is important is that you transport them in an appropriate manner. You don't put them in a taxi or in a vehicle where you don't have that kind of support to get them alive to the next station. And that's where the issue of ambulances, being readily available comes in. I don't know how your friend, may his soul rest in peace, how the friend was transported. And really, if a facility has run out of oxygen and you are transporting to another facility, was the patient maintained on oxygen? Was some basic and minimal care provided in the course of the transportation?
Right.
Okay, was this situation communicated to the receiving end? Okay. So there are a number of issues which have to be addressed.
My observation is that the private hospital don't want to mar their record.
Yeah, but I think one of the
so what they do is immediately they see that the management of the case is that bad, they quickly want to make sure that they take you to the nearest referral public hospital, so that they don't bear the brunt.
I am not too sure whether the picture you have. I'm not too sure.
You don't want to bear that brunt.
I don't want too sure. I don't work in a private facility, but I don't want to. I'm not too sure the picture is exactly what you are painting. Okay. I think one of the presenters said that they have their own objective in running private hospitals, which is different from what pertains in the government hospital. We have the kind of social, net at the back of our mind. Okay, so if somebody is running a facility and he thinks that it's gotten to the point where he hasn't got the expertise to continue to manage, when you come to a government hospital, we have pulmonologists, we have specialists in asthma care and all. They don't have the patient. In fact, you must be happy that sometimes they are able to detect the problem and then refer the patient or escalate the care to the other level. Because sometimes it's been a situation where they've sat on these patients and eventually the unexpected or the outcome we don't want have happened. Thank you.
I see.
All right. So
I mean, Roland, I was just going to say that if we don't have facilities that are well managed, we don't have readily accessible facilities, how are we going to manage Mahama case? And I bring it to you, Dr. Olenu, because I should take it. Dr. Lenu says I should take it to Dr. Jokoto. So maybe I'll split it. Both of you would answer. So Dr. Jokoto, since you've been quiet for a while, you should start with that one. We are talking about all these things, how poorly looking our facilities are. Perhaps those of us in Accra and within the environs of the likes of the University of Ghana Medical Center, the Ridge Hospital, Kolebu, and the likes. Maybe we may not see the problem as real as we are saying it. But for those outside, far away from these facilities, far away from TTH, far away from Konfanoche, how are we going to benefit from Mahama cares if these facilities don't exist?
Let me just...
No, it's directed, Doctor.
Okay.
That you can.
You have your bite, Dr. Nawani. Let Dr. Jokoto go first.
No, it's just...
So thank you very much. So we are on a certain journey. We may not reach the ideal situation immediately. It's going to take some time. The Ghana Medical Trust Fund, affectionately called Mahama Cares, is here to fill a certain gap. So currently, if you look at the funding, complications from non-communicable diseases like cancers, hypertension, diabetes, they are not fully covered. So President Mahama made gave a very compelling example during the inauguration, how families are having to lose all their wealth and eventually still lose their loved ones just because of the cost that is involved. So that is the gap that the Ghana Medical Trust Fund seeks to fill. So renal dialysis ought to be covered by the health insurance. We started last year. We are still working on it, but now there will be sustainable funding when the Ghana Medical Trust Fund comes. And if you look at the sources of funding, some will come from government. We are looking at development partners. We are looking for at mobilizing funding from within. So this is one innovation to address some of the challenges that we have all been talking about. So it is supposed to improve upon the situation that we have now. So it's going to look at equipment. We are also going to look at capacity building for staff who are going to manage non-communicable diseases. Annually, this fund is supposed to pump in between 2 billion to 3 billion Ghana cedis towards improving infrastructure, equipment, and paying for the cost of some of these services that our people are to receive. So yes, it brings some hope, but like I said, it's going to be a journey. It will not be an event.
Indeed. Dr. Nawan, you will hear from you in a bit, and Dr. Olenu, but let's share with our viewers what they have been asking and saying, commenting on our socials. On Facebook, Rita Bentumi says, Roland, the doctors are not helping the country to also get money. I think that's a point that we have made here strongly. The reason is that you will go to the hospital and do x-ray, you'll be charged, and on your receipt, it won't be like that. I'm a victim in 2023. I went to do x-ray in Koforigia. I was charged 500 cedis, but on the receipt, it was 150. So I asked why, and I was told the doctor takes 350 cedis. I couldn't say more because I needed to be healed. Dr. Mensah, this one is this one is for you. So you tell us why some of your members are doing that.
The hospital wasn't mentioned, but I think the right thing that the client should have done was to report to management. I don't think that any management or a health facility head will endorse this. It's obviously an anomaly which needs to be checked. And I was even curious, whoever is taking 300 and more than what the official cost, yes. They're not even taking like 5% or something to be able to explain it. But this one, I cannot explain for you. So I think that the clients need to be encouraged, that in certain situations, for our own good, maybe it's happening on the backside, on the blind side of management, and they will report this. You can't explain this in any way. So that is to return to me.
Indeed,
Thank you.
Dr. Ba is also itchy to comment on this particular
Yes,
one.
I think he can.
But I think that doctors don't do X-ray. X-rays are done by...
Maybe he owns the money. His facility owns the money.
So the message says that...
I don't know whether it's government or private, but if it's private, I don't think there will be an issue. If it's government, doctors do not do X-rays. Okay. But I see most people come there and everybody in the white coat, they say doctor. So, but I think, like you said, the best is to report, so it will be investigated.
So the Rita says that she's not saying it was the doctor that asked for it. When she inquired why the receipt was not the same as what she had paid, she was told that the 350 will go to the doctor.
He's scammed.
He has been scammed. Somebody else took the money.
Benages Media says CHIPS compounds do not provide emergency services. They provide most basic primary preventative health care. Thanks. Perhaps we'll take that to Dr. Olenu in a tad. Maybe it's time CHIPS compounds do a bit more than just that. Because for places where it is extremely difficult for people to reach.
So they are doing it. It depends on the experience of the nurse that is there.
Yeah.
If you come with gastroenteritis, vomiting, and
they can manage the situation.
Yes, it's an emergency. And if there's a nurse there who can set the lines and other things, they'll do it.
I see.
They'll do it. They'll start.
So, but they are not supposed to manage emergency cases.
Yeah.
Or it depends on
It depends
on what we mean by emergency.
Yes. It depends on what we mean by
that. So in the book, they are not supposed to do, but in reality, they do.
They do.
That's what they are saying.
The experience of the nurse counts.
If you do it at the CHIPS, you will not be paid for it. In the first place, they do not have the expertise to do that. So the CHIPS compounds are supposed to first. There's a package of services that they deal with. So maternal child health, A&C, postnatal care, and then you have vaccination. They lead that drive, and then health education and all that. So when you come in and it's beyond them, then they refer you to the health center for you to be taken care of. But it's not their primary responsibility to do that.
But considering their importance, I guess it's time we looked again at what they are able to do. The importance of the service they offer to some of these rural...
So the health service is a continuum.
About what he has said, but looking at the setup, we've been talking about infrastructure since 9 o'clock, but looking at what they have, what do they have in there to be able to provide the services? So the experience, like Honorable said, will count, but at the end of the day, once it's beyond them, the focus of the care is to save lives, save lives and prevent whatever. So they will always refer once they cannot handle it.
I see. Roland, please, I'm in a CHIPS compound and I don't have anything to work with, not even the thermometer and dressing set. Please let them know it's really frustrating me. People come here and I have to let them go to a different place all the time. My facility is in the Upper East, Bolga East, to be precise.
Adjosali.
That's from Adjosali, indeed. You live inside Doha? No. Well, they're commending us.
Daniel,
be precise.
Adjosali.
That's from Adjosali, indeed. Well, they situation is important, guys. So they say they are watching us. We are the CNN and BBC of Ghana, or we could compete with them. Thank you. The private facility do motivate the nurses and midwives, but the public side, it's a big no. That's coming from Augustina. The issue with our health systems is purely poor management. Kadir brings in that message. And there's Kadir again. I think we've gone through all of them, all the messages we've had so far from Facebook. So, Dr. Lenu, just quickly, let's hear your thoughts on the question I asked earlier about the need for these facilities and, dealing with some of the outreaches that you'll be handling in the future.
Yes, so as Dr. Jokotu said, to me, I think the Mahama case is an excellent initiative, because having gone around the country to see how people are suffering from the long-term financial burden of non-communicable disease, this is very excellent. I'll give you an example with prostate cancer, because I'm very passionate about it, because men, we suffer in silence, and but it's something that is very dear to me. You are diagnosed, you have to be on a lot of them are diagnosed late because people are not screening, etc. And it's part of them. That's something we want to do as well. Encourage early screening, then we pick them up. But for those who are on treatment, you realize that after a while, the burden becomes so much, because a shot of, I think, Zoladex is almost 5,000. And you have to get that shot every 3 months. So you can imagine, after a while, they cannot. And then they have to resort to more dangerous therapies. And men, we are being advised to eat lots of cassava nowadays. And then the fruit, what's the fruit? There's this fruit, I've forgotten, right?
What does it do?
Yes, people, the leaves of the fruit, it's supposed to do something. So, people just stop their therapy and then they just go and do dangerous things. So, in order for Mahama Care to really impact, we need to improve the infrastructure. It is very important, and that's something we are working on. The Director General is going around the country ensuring that things are in place.
Is the DG also inspecting abandoned
projects? Yes, the DG is inspecting. Yes, because what happened is that he even recently sent a communique to all facilities to stop charging for using their washrooms. Yes, so he's really on this issue. So we need to improve the infrastructure so that we can first of all diagnose and then treat, and also to make the health sector very responsive, where we are responding to the non-medical needs of the people, because people are worried about how they are treated when they come to the facilities, you know, where they are seated, how the staff talk to them, you know. So these are all non-medical aspects of the treatment. And people look at that and they tell us that our facilities are death traps. So we are doing lots of capacity building to create the awareness, to beef up the knowledge of healthcare workers to avert some of these things. So I think we are poised for success if we all put our hands together and then work. Put our hands on the together.
I'll take final words from you, Bright.
Thank you very much, Kemi. So we once again congratulate TV3 for such a forum. It's timely because we are still in the process of the reset agenda. And let me say that when we mention public, everybody is looking at the government. Our population is increasing, our lifestyle is increasing, our taste, everything. So it's about time we align these to what our healthcare system is and the qualities that we expect. So whatever that we see in our lifestyle is what the community is requesting for. So leadership is always key, as we have mentioned. When a leader from even the facility falters, we will mention the name of the president. The same way, even if it's a facility nurse or something, we mention the name of the, what do we call it, the leader over there, either the medical superintendent or whoever. So everything boils down to leadership and then governance. In the various ranks, whatever pertains to you is what you are supposed to do. And then we should exhibit leadership skills. With the IGF issues, I believe we should include fundraising. Let us take those leadership roles up, engage the MCs, the stakeholders around you to say that this is the state of our facility. Let's take some initiative and then government comes to support. Same is happening at Kumasi Konfanochi. And you see people from abroad are supporting and they are fixing some things over there. So it's about leadership. They take up some roles. They align in their budget what they will use to fix what. And then also they have to create proper awareness even within the community stakeholders to understand that we need this support. Then people can willingly come to their aid and then support them. Yes, in as much as the whole burden is on government, as we look up to, there are other individuals and philanthropists who would also be in the capacity to support, depending on how you present your issues. So let's cost all these things and then present the document and then call for a forum in this way at the localized level for people to contribute, and then we fix the challenges thereof.
Well, Dr. Mensah.
Okay, so we cannot emphasize this enough. Leadership, governance, and the enabling environment, not forgetting partnership, teamwork. Okay, this is the only way we can actually make progress at the level of the facilities to give us what we expect. Thank you.
Thank you. Perhaps members of our audience, many of them from HEFRA, anybody wants to say something briefly before I hand over to Roland? Dr. Akun, why are you looking around? Dr. Akun is from HEFRA.
Right, so this is a fantastic forum, so kudos to this organization of it. Everything that's been said here, absolutely correct. As HEFRA, what we are doing is we are working to provide the data that is needed for the policy development. Changing policy, changing the way we do things without the adequate data makes us shoot blindly. So next week, we are starting a nationwide exercise. We are going to all the health facilities. We are going to see what is the current state. We will generate recommendations, provide that to all our stakeholders here, and then with that, make Ghana better.
Very well. Thank you so much, gentlemen. Surprisingly, all four of you are men. But thank you so much. I'll hand over to Roland now. Roland, on your end.
Well, so we have to call it a wrap, but before we do that, just in terms, what lessons can we take from this and say that based on policy, what pertains situationally could be improved? Just in a minute.
All right. So I think from the discussions today, we all agree that there is a problem. Our health facilities need a facelift. We need increased manpower. We need increased funding. How can we do that? I think that we need all stakeholders to come together. The local government has to be part of this. Washrooms and wash facilities, they should be able to do those for them. We need government to come, and Mahama Care is is also on board. So we think that regulation must also be key to keep them on their toes.
Dr. Nawani, already you should be putting pressure on government. We have facilities that haven't been completed yet. Some, is it inherited, right?
Yes.
So La, for example, was pulled down, supposed to be at an incremental level. If Young Kwanta, the Ajana 111s, etc. What do we do?
Indeed, government has promised that they are going to continue with all uncompleted projects. And they are doing it, but it depends on the availability of resources, I must say. The problem that cut across wherever you go is the lack of staff. And I'm going to ask the government that they should do selective financial clearance. They should look at a particular facility, what they need, and post people there, give them financial clearance, and let them go and work over there. You know, that type of wholesale financial clearance might not be the way to go if they don't have enough resources. And of course, like you are saying, the uncompleted projects is something that the government have to continue. If you take Agenda 111, we have already spent about $400 million into it. So these are inherited assets, and the government have to continue. But the low-hanging fruits, like I think Koforodia, there's a hospital, the regional hospital now have a new site. They need to move there. They just need some few things to be able to move there. I believe that the government should accelerate the process and make sure that they get there. And all those facilities that are near to completion, no, they should do something and make sure that they bring in the extra beds that we are talking about. But above all, we need more resources for the health sector. Let us agree, whether it's coming from the government and to be free medical care, or practically as it is happening, either we get it from insurance, or from extra insurance, or from the packet or somewhere. We need to think about it.
All right.
It's something that we need to think about it. Mahama Care is coming to help in terms of extra resources, and we appreciate the effort of the president.
I get your point. So he's talking about being more innovative in healthcare financing. But that also means that your personnel would have to be retained, right? So that they don't go abroad very often just because of the lack of incentives here. How do we tackle that?
It's important that as unions negotiate with employers on collective agreements, we have those collective agreements implemented. It's key, because within those collective agreements are also incentives that can motivate health professionals to stay and work. So it's very important that we look at that. Also, create systems where specialization is made easy in terms of sponsoring some of these programs for nurses, for doctors, and other health professionals. And most importantly, to ensure that the population have easy access to health services that are of quality and doesn't bring them financial burden. It's important that we strengthen the National Health Insurance Authority. The levies that are coming in, for those of us in public sector, we contribute 2.5% of our monthly income to as levy. And more so, even in there, we don't even have free access to healthcare. When you are sick, you are burdened with your own health problems. So it's important that the authority also looks at this and provides some sort of care to health professionals, because it is our own space. And also ensure that the tariffs that need to, the increased tariffs in terms of reimbursing facilities are done quickly, so that they will have enough resources to run the daily services that they give to healthcare professionals. But let me conclude by saying that public services is for the good of all populations. Health services is a responsibility of every government. The new government, the NDC government, must do everything it can to increase budget allocation for health and ensure that there is enough resources within the health space for Ghanaians to be kept healthy all the time.
All right. And lastly, a lot of burden on you. Now, uncapped, etc. We need to be very innovative as to how we fund and then increase the threshold in terms of beginning the conversation. If whether it's a percent in terms of what we collect for the National Health Insurance Scheme. All right. And then also, how do we manage a trust like Mahama Cares as well? How do we fund it? It's a conversation that needs to be brought forward.
So, thank you. I'll begin from the Ghana Medical Trust Fund. The bill would be in Parliament very soon. I think during their next sitting, they will have access to the bill, and all these details are in there. I may not want to discuss it at this point. But, Roland, let me thank you for bringing the nation's attention to this issue. The gap between rural and urban Ghana in terms of health infrastructure is huge. Between Ghana and the best practices across the globe is even bigger. We need a huge resource investment there. Secondly, we need an appropriate funding mechanism. We need the right policy environment. And already I've said, governance, the structures, appropriate structures to ensure that we get there.
Thank you very much. As Dr. Jokoto, Deputy CEO for the National Health Insurance Authority. I also have to mention that he's a constituency, one of the leading constituents for the Keta constituency as well. So, who's your MP now?
He's called Honorable Kwame Gakpe, a good friend of mine.
Oh, okay, okay, great. And then also we have here Madam Oforiampofo as well, and so thank you. When I was introducing, I was introducing myself early on. No, before we came live, I said Dr. Oforiampofo. He said, no. So perpetual by the first name. Residents, when it comes to nurses as well as midwives, the mother body by way of the association. Of course, Dr. Nawani and all of us have been fighting over financing, managing privately and publicly, and lessons from private health sector management that could also be brought to public sector management. And I think that's been very instrumental in the conversation. Thank you. From the Committee on Health, Parliament. And then, of course, Dr. Ban is fresh to HEFRA, but not new to the workings of HEFRA. He's been making a lot of promises. He will change, he'll do that, but the facilities are still poor. So we'll hold him to it. The videos are still available. And what do they say? The internet doesn't lie.
Never forgets.
Doesn't forget.
Okay, the internet never forgets. So we have clear examples. But thank you all as well. And Kamini, we've had some good ones on your side as well.
Indeed, Roland, let me also say a special thank you to the gentleman on my side, Dr. Wallace Odiko Olenu, with the Ghana Health Service Non-Communicable Diseases Control Program, and Bright Emisa Jokoto. Excuse me, Bright Emisa Nyako. Bright, I apologize, Bright Emisa Nyako, who is with NGOs in Health, and then also Dr. Andrew Mensah, the regional chairperson, the Greater Regional Chairperson for the Ghana Medical Association. Gentlemen, thank you so much for joining us here with your expertise, your thoughts, and your wisdom on the health sector. But before we go, just a quick look at one last comment from Facebook on the National Forum today. If we could just slap that on the screen quickly, so we show that to our viewers. We wish the government will pay more attention to the CHIPS and health centers, because most of the staff are being abused emotionally, psychologically, and at times physically in the communities. Kadir Jumal Zainab. Again, that's a question I had posed to the health workers here, and hopefully some finality or some resolution is brought to the problem of the mental state of the people or the health workers who work in these areas. But it's time for us to go. So a special thank you to you two for watching us. I'm waiting to see my face on the TV. Roland, it's time for us to go.
Yes.
Thank you to wherever you watched us, joined us from. We are definitely grateful. We appreciate it so much that you could stay with us the last 3 hours or so for this National Forum. It won't be the last. It's only the beginning of many thought leadership events to come here from Media General. My name is Kemini Amado.
And mine is Roland Walker. Make sure you join Kamini and Eric Mawinagbeta for our next bulletin. Bye-bye.
Bye-bye.
After this fufu and pepper soup, I go score goals like them the dash points. Hey, Shishi.